Hey, Mark Whalen here from 5 Points Acupuncture, coming at you with another edition of acupuncture explanations with shitty illustrations. So here goes. This is a shoulder. This is the head of the shoulder, the arm bone here. These are the key structures in the shoulder. We got the AC joint where the clavicle meets the acromion, and this little joint often gets strained in injuries. The bursa gets inflamed and is known as bursitis. This is basically the deltoid or shoulder muscle. The labrum is the small inner lining of the socket. And then we've got the rotator cuff muscles here, which are pretty illegible, but there's 4 rotators that get strained quite a bit or torn. That's a very common injury in the shoulder. So let's talk about what acupuncture can do to treat them. All right, so these are some of the common conditions that we see in the clinic. We treat any kind of muscle pain and strain. That includes the labrums, the rotators, the deltoid muscle. Bursitis, again, inflammation of that bursa sac. Frozen shoulder is very common. AC joint strains and sprains are typical to treat. Any type of arthritis, particularly osteoarthritis in the shoulder joint. And then we can also treat any type of pinched nerve coming out of the neck and the cervical vertebrae that may run through the shoulder. Acupuncture works by reducing pain, reducing inflammation, it improves circulation, and it can help improve mobility. It will not improve handwriting, as you can see. So the first step in determining the best course of treatment for you is to do an assessment when you come into the office. What we're looking for is to identify any of the muscles or structures involved in what's causing your pain or whatever your condition happens to be. So there's 3 different options. Typically, we can either do local needling or distal needling. Local is right around the area of the pain. Distal means it's away from the pain. So anytime we're doing local needling around the shoulder joint itself into the muscles, either in front of or behind the shoulder, a lot of times I will be adding electrical stimulation to kick off a higher endorphin release to help treat the pain levels and take circulation down right away. Distal needling is also very good for that. And what that means is we are treating an area away from the pain, but it relates to the painful area. So in this example, this is actually someone's leg and this is a knee, if you can believe it. Needling these points along the tibial bone right under the kneecap here will actually have a good effect on a lot of muscular shoulder pain on the opposite side. So we will look to do that first to trigger any kind of quick relief for you so we can know right away whether or not you respond to treatment. Another option from there is also we have topical treatments, which could be either red light therapy or some topical pain relieving creams and ointments that we have. So if you need help or you have questions, give us a call, 781-944-3000.